Thanks all for joining us. Hopefully you can all hear us okay in the room and online. We know that there's a few other sessions, so we appreciate you guys picking us. So thank you. It would be really interesting as a first sort of point to just see how many of you know about the world of standards and standardization and are familiar with it. So we've got a little poll going that will hopefully you guys can have a quick look at through the app. It just helps us sort of understand how much you guys know about it, the world of standards and what we do, or whether you've come in fresh, which is absolutely fine. We will run through everything today. I will let the panel introduce themselves soon, but I wonder if it would be useful to just give a quick run through of who BSI are. BSI is the UK's national standards body. We're responsible independently for maintaining the infrastructure for national and international standards in the UK. And we bring together stakeholders to develop consensus-driven standards that capture what good look like. The standards that we talk about are voluntary market-developed standards, but they can be used in support of regulation and are helpful in terms of developing and supporting policymakers. BSI is appointed by the government to provide the infrastructure for around 13,000 experts who are the voice of UK economy and social interests to be influential in the international standards space of ISO, IEC, CEN, and CENELEC, and ETSI. The standards that we talk about are created by these multi-stakeholder committees. The committees are shaped by businesses, by academia, by regulators, government, and consumer representation. And we'll hear a bit more about that soon. The standards that these committees developed are designed to be clear, unambiguous, and provide what good practice looks like in different areas. And they can be really, really beneficial for businesses to be able to support and understand what good can look like. The BSI is very active in AI. We have a committee called ART1, which is a mirror of an international committee, of JTC1, which is a joint technical committee between ISO and IEC, and it's SC42, but also within the European space of CEN, CENELEC, which are private standards development organizations based around European stakeholders, JTC21. There's a few really interesting standards that we can talk about later that are within the national portfolio, but just to touch on a few, there's a management system standard for AI that's being launched this summer, and it is called ISO IEC 42001. And what a management system standard does, it helps organizations to implement AI into their systems, and it will really be a new wave of enabling businesses and SMEs to understand how to implement AI into their systems. BSI is also a strategic partner of the AI Standards Hub. We work very closely with our partners, the Aaron Turing Institute and NPL, the National Physical Laboratory, as well as the UK government. And if you haven't had a chance, I would encourage you to join the AI Standards Hub community. It's a community of practitioners dedicated to evolving the international field of standardization in AI, and trustworthiness is a main theme. We know that AI is uniquely transformative. It brings significant economic value and helps solve some of the biggest societal challenges that we're facing. Has the potential to accelerate our capabilities towards a sustainable future and help us understand how to stay healthier and what medicines and technologies to use when we are unwell. Given the huge potential of AI technologies, we're seeing a significant uptake of AI within everyday technology products and services. But do we have the right infrastructure and governance systems in place to support the emergence of AI? So with that, I'm going to direct you to a second poll. And the poll is a question around when you think about AI technologies, how much do you think about the governance systems that sit around them? Because today we'll be discussing that. We know that delivering trustworthy AI is a key pillar of the Scotland's AI strategy. And great to hear today that standards were referenced numerous times in the keynote speeches, as well as Katrina Campbell's keynote on what the role of standards in support of regulation. Today, within this panel, we are looking at what we need to deliver trust within industry and across society when we deliver AI. We have brought together stakeholders from across healthcare, manufacturing, and consumer products to give you their perspective on what trust looks like in their sectors, what governance frameworks are in place, and what opportunities there are to create trustworthy AI. With that, I am going to let the panellists introduce themselves. James.
Hi, everybody. My name's James Blackwood. Most people just call me JD. So I have 3 roles in AI. So the first is I'm the healthcare AI lead for the Scottish Government in healthcare. So responsible for advising government on policy, strategy, technology. I'm also the AI strategy and portfolio lead for NHS Greater Glasgow and Clyde. So that means I'm going to be responsible for writing the strategy for the Health Board and how it's going to use AI, but also develop the wider programme of AI, not just research, which is primarily where AI is focused in healthcare at the moment, but also the adoption of AI into clinical practice. And finally, for the last 4 years, I've been the Chief Technology Officer and the NHS National Programme Manager for something called iCared. And iCared is the largest healthcare AI research programme in the UK. So we have 50 AI projects with 40 partners and about 300 staff, worth about £25 million of investment. And as part of that, we have built the first AI-specific trusted environment for doing healthcare research. We've digitised pathology within GGC, and we've delivered on those platforms a whole sequence of projects which span frontier research all the way through the regulation process, the evaluation process, and hopefully in the coming 2 years, the adoption process.
Brilliant. Thanks, JD, for being here. Michelle, over to you.
Hi, I'm Michelle McKenna. I'm a volunteer with the Consumer and Public Interest Network. So for anybody that's never heard of CPIN before, we're an organisation that believe that consumers have the right to safe goods and services, to clear information and to fair treatment. And we do this through our input during standards development, where we bring real-life consumer scenarios to standards development and make sure they're addressed to provide safer and fairer goods. My background to that, my expertise comes from consumer protection. I've been a trading standards officer for the last 20 years, where I lead for my local authority in product safety, doorstep crime, and deal with consumer vulnerabilities. So I use that experience to input to the real-life scenarios within the building of British standards. I'm really interested in AI and the potential that it has around about consumer goods, so particularly educational toys for children, in condition monitoring and product safety in terms of white goods. So I'm really interested to hear the discussion today and get involved in this panel.
Thank you so much, Michelle. Great to have you. Andrew.
Hi, yeah, so I'm Andy Sherlock. Like JD, I've got 3 jobs too. Competing. So I'm Director of Data-Driven Manufacturing at NMIS, which is the National Manufacturing Institute for Scotland. So I lead on all of the data aspects across the whole of National Manufacturing Institute. So we're sort of involved in using AI and machine learning to optimise manufacturing processes, to kind of optimise manufacturing operations and think about new business models for manufacturing companies when you start to think about what you can do new with data. So I lead on that at NMIS. I'm also CEO of a company called Shapespace, which we spun out of Edinburgh University about 15 years ago. And we develop analytics and machine learning algorithms and libraries that we license to a number of other engineering software vendors that get deployed in some of the biggest automotive companies in the world. So we've got some experience of developing and then ultimately deploying some of this software into manufacturers. My third hat is I'm a professor of practice here at Strathclyde University and work with the Industrial Informatics Cluster.
Brilliant, thank you so much. Great to have you. So I know that you guys have access. Please start adding your questions onto the platform. So we'll try and have both in-person and online questions both on the platform. So please do start adding them right now and submit them. And like the questions that you think would be the most priority for us to answer. How are the polls looking, Katie? Oh, right. Well, we'll explore the polls and come back later. In the meantime, I will ask the panel a couple of questions. I think what would be really interesting is to understand from each of you, what does trustworthiness mean in your sectors? JD, do you want to?
Yeah, so I think we spoke about it this morning, the keynotes this morning. So in healthcare, right at the very top of trustworthiness is safety. So when we talk about trustworthy AI, we talk about safe, secure, effective, and fair. So we need to be able to trust that the algorithm that's executing ultimately quite often to give some sort of treatment to a patient, some indication of their prognosis. We need to understand that that's actually trustworthy, that it's safe. We also need to understand that it keeps people's data private, so there's no leakage of information outside of the AI system. And depending upon the stakeholder you speak to, you might want the algorithm to be explainable. So actually we find that the patients themselves, you don't often have a patient come in and ask how the MRI scanner works. They kind of don't come in and ask how the AI works. But if you're a clinician and giving treatment to somebody, you want to understand that it's giving the right answer. And as an example, we were recently doing some work in pathology, and we have an AI algorithm which looks at prostate cancer in tissue. And the algorithm gives an answer, yes or no, pretty much. It says it has cancer, doesn't have cancer. And actually in America, they found that that's okay. But in the UK, the very first thing that our pathologist asked were, where is the cancer? Show me the cancer. Yeah. Show me the boundaries of the cancer. Grade the cancer for me. And tell me how you've been able to separate the tissue from the blood from the mucus. So just having an answer and just knowing that the AI had been through a process of safety, security checks wasn't enough. They had to be able to see how it came up with an answer. So explainability is important, but more important than any of that is evidence.
Yes.
So we're fortunate in healthcare. The device has to be regulatory approved before it can be used in a healthcare environment. But ultimately, the first thing that clinicians, information governance, security, and AI people look for is, do you have any evidence that that particular tool worked with the same population for the same scope of use within a similar type environment? And so to be trustworthy, we need evidence to say that this works in its intended scope of use.
That's really interesting. Michelle, in your world, consumer products?
Yeah, I would say it's similarly to JD in terms of SEPIN and our priorities. It is really about the safety and transparency. After homeschooling 2 children during the pandemic, I know there's huge benefits in terms of the education that you can get through an AI and interactive toy, if it can teach languages and all sorts of other things. But if there's a risk that product will then harvest data and potentially build a profile on a child, for example, and then use that against them in later life or use that to target advertise, then that's hugely concerning. There was a doll a few years ago that through conversation with a child, it was found to be recording those conversations, also recording conversations with parents and siblings and other people, and that could be transferred to a third-party company, which was obviously hugely concerning. The toy was banned in Germany and told to kind of get it out of the homes. And similarly, there was a Barbie doll that was building a profile on a child to have better conversation, and that was seen to be crossing a privacy line. I know I asked my daughter yesterday the time, and she has a clock on her wall, and she asked Alexa the time. So we have these devices in our homes. We want to know that what they're doing with our data. So that's a real priority for SEPIN, and they actually led on a standard which was consumer protection, privacy by design, and that is asking the manufacturers to, at the point of development and design, explore where the potentials are for the data risk and mitigate against that to stop the harm happening right at the beginning. So I think that trustworthiness is built through, it can be eroded if there's a product that comes out that takes away that trust. And equally with condition monitoring and white goods, yes, there is potential for improving consumer products and the safety of them, but you need the consumer's trust to buy into that. So they have to connect to Wi-Fi, for example. If they think there's a risk of data breach or anything else happening, they won't get the benefits. So the benefits there are, if the product breaks, it can automatically transfer that data to the manufacturer. It can order parts, it can order an engineer to come out. So that's a benefit to the consumer. In terms of product safety, if it develops a fault, that information is also going back. Consumers don't often give information back to manufacturers. And there's also potential that they could actually shut the goods down. So if there is a safety defect and it's reported and that could cause a fire, then they can disable the goods. But there's concerns around about consumer protection issues there, ownership of goods, and also unintended consequence. So if you have medication that you keep in a fridge freezer and you need that to be temperature controlled and it can be remotely shut down, that's a risk. So we need to be considering all these things right at the design stage.
That's really interesting. Andrew, what does trust mean?
So I think one of the things that we're seeing in manufacturing and engineering is that there's a kind of growing acceptance that there's big benefits from using these technologies, and people like Rolls-Royce have sort of proven that, and they know that there are some fairly substantial cost savings and capability enhancements that you can start to find by using these technologies. I think when you start talking about trustworthiness, I think it's that you're only bothered by trustworthiness when there's harm, I would imagine. And I think in various aspects of engineering and manufacturing, we're dealing with products which have the potential to cause significant amounts of harm. So, whether that's your airplane falling out the sky or your nuclear power station blowing up or all of these types of things. So I think where we're not so bothered about the harm or that there's a human in the loop, so we're finding solutions that a human can then confirm, I think we're seeing take up in those areas. I think where we're dealing with putting actual machine learning into safety critical applications, I think is an area where you really have to start thinking about explainability and convincing regulators that you understand the operation of this algorithm in all of the possible operating scenarios that it might go into. And I think, so we're hearing from some manufacturers about the need to start to take the regulator on a journey with them, and it's kind of back at the start of that journey at the moment. So I probably, of the people on the board, I know nothing about standards. So, and I think it's quite interesting that I don't, because I've probably worked on 20, 25 different AI problems in manufacturing over the last 20 years, and never once have I thought about using standards in there. And we're starting to see that, I think, needing to be part of what we do as engineers using these technologies.
That actually is a really good point. So, you recognize now that there needs to be some governance structures. You're now becoming more aware that the technology is reaching a stage or a sort of a capability, or is becoming much more entwined with everyday users and everyday life. So you're noticing, as you're saying, that you need governance structures. I mean, are you spotting areas where you're seeing that that's becoming an issue or hampering, or where are you seeing the need for governance structures?
So so we mentioned Rolls-Royce before, but we were sort of talking to them. They've come up with this Alethea framework, which is about making sure that you go through a sort of checklist of things to think about whilst you're starting to implement an AI project. It's interesting their motivation from that, from what I was told, is a lot of that's about convincing a regulator that they're doing sensible things.
Yes.
And it's really interesting to start to apply that into some of the things that we do at NMIS is, you know, I think you should be thinking about it all the way through the life cycle of the project. I think sometimes it's bolted on at the front and you sort of tick that box and then that's it done.
Yeah.
But exactly how you do that and how, I think the evidence bit is really important. So how do we convince regulators and ultimately consumers all the way through that we've got the evidence base that the algorithms we're developing aren't going to cause harm, or we can put a bound on how big that harm will be.
Yes. Yeah, and I think you sort of touched on the sort of the code of practice is one end of the spectrum, and then obviously the law and regulation is the other end of the spectrum, and sort of the space in between is where standards really come into their own and start providing those good practice that maybe not necessarily law, but is a means to identify what good looks like. I mean, you see the role of standards a lot in the healthcare sector.
We very much do, and actually standards have to be introduced at the right time. I think this is absolutely critical. So there is no point introducing a standard before you know what you're doing. And where we are in healthcare right now is, to have a medical device, so any software being introduced for the treatment, diagnosis of patients would be called software as a medical device. That's regulated. It's regulated in the UK by MHRA. And underpinning getting your compliance being regulatory approved, your CA mark, as it's now been called in the UK, will be following standards like ISO 13485, which is effectively a quality standard that says when you built this piece of software, you followed good practices. And so you'll find it impossible to get your device regulated if it's a higher risk product. So the regulation of the products are classified from 1 to 3 actually, and the higher the risk. So you'll find it impossible really to get your device approved for use in the UK market without having followed a standard.
Yes.
And interestingly, it's the first standard because it's at the front of the process. Yeah. So you have to be able to do it to build it. Now, in healthcare, we've not adopted a lot of AI into clinical practice. So perhaps not surprisingly, we don't have a lot of standards around adoption. We don't really have a lot of standards around how to evaluate and validate products because we've been waiting for them all to be built so that we can start to use them. So I think you introduced them at an appropriate time. I think the other interesting thing about healthcare is the interplay between standards and regulators. Yeah. So I think when you're dealing with the safety of patients, it wouldn't be appropriate to allow people to just voluntarily build their products to a standard or voluntarily regulate it. So it's really important that there is a regulator and that you have to follow a process. But interestingly, that brings its own issues. And one of the issues it brings is just because you've got a standard doesn't mean things are standardised across the world. So actually, if you follow 13485 and you get your device CA marked in the UK, that doesn't mean you can sell it in Europe. That doesn't mean you can sell it in America. It doesn't mean you can sell it in Japan. And there isn't an equivalency of the acceptance of the underlying standard across all of these different countries. So I think we just need to be very careful that sometimes the standards help. They only really help with promoting that consistency internationally in all your markets.
Yes. That's a really good point, actually. I think as the world, especially the fact that this technology is so global, this really brings into focus the need for international standards. And not just creating codes of practice or standards that are just based around a set small group of stakeholders, but identifying what that global good practice looks like so that it can bring a bit more of that certainty that you are sort of getting the same product wherever.
And they're expensive. To adhere to a standard is expensive and time consuming. So you don't want to have to do that 5 or 6 different times.
Yes.
You want to be able to just work to one standard, and once you've done that, you want to be able to release your product to the world. And we're talking about sometimes companies that have no capital.
Yes.
They're 2 people, they built some interesting tech. They can't afford to take 5 years and do this 5 different times just so as they can start to sell the product. So it's really important those standards help promote innovation as well. So the interplay between following a standard and being able to innovate is crucially important, and we see that in the UK right now with the MHRA looking at the underlying regulations to say, can we make this faster? Can we make it cheaper? Can we make it more consistent? And I think in different industries, you've got different levels of maturity of standards and regulation, and we're just starting to mature in healthcare. People in the audience might think that we are heavily regulated across all parts of the AI process. The answer is AI is new in healthcare as it is most other places, so we're just starting.
Yes, that's really interesting. So I know in sort of the product sector, physical products, this is a well tried and tested process, isn't it, Michelle?
Yeah, it certainly is. In terms of product safety, it's heavily regulated, and we have regulations, and people manufacturers tend to comply with those regulations by following standards, and the detail is within the standards. So if they follow the good practice of the standard, that they're likely to become compliant. As you see, it is new, and there's a lot coming in, and I don't know that legislation is really keeping pace with how fast. It certainly isn't keeping pace with how fast the technology and AI is moving. And we heard this morning about the absolutely fantastic work that can be done around about using a voice and using that when people maybe lose their voice, and how that can improve their life, and it's absolutely fantastic. But there's concern where scammers can use that, so they can take someone's voice and clone it, and then that could be used to, you can just imagine a grandparent receiving a phone call and they think it's their grandchild, and they have that interaction and they lose money. Also around about copyright, the copyright legislation that's there doesn't necessarily offer the protections that, with awareness of what's going on in the AI world. You just had to hear that with David Guetta, who sampled, got an AI program to write an Eminem song, and then used another program for him to sing it, and then that was sampled and there was no copyright breach in there. So we really need to look at the legislation. Yes. Sometimes legislation takes a long time to get into force. Standards can work a bit quicker than that.
Yes.
Do you think there's a role for kind of informed activists in all of this? So, hold our hands to the fire kind of thing. Make sure that we're doing this, because the standards won't capture everything and they won't be able to keep up. Yeah. But then uninformed activism is probably not that helpful.
Well, I think that's where we heard this morning that we really need to make sure that in Scotland we have innovation, and we keep people here, and we're working on that. But when we talk about regulation, we have to make sure that we have the regulators. So who is going to be responsible for regulating it, and are they keeping pace? And so these are all things we need to consider.
I think I quite like the idea of an informed activist. So in a way, that is what you need, in a way, is everyone has expertise in their individual areas, and they are those informed people that know about the governance issues that are coming down the line from their sector. And if anything, it's almost like a call for them to come out of those and engage more with this community that is trying to capture good practice, because without its regulation is very useful when there's a market failure or where there's a consumer protection issue. But it can be difficult to enforce. It can be difficult to change. So, as you say, once this technology moves really quickly, how can regulation may not be able to keep up? But the role that standards can play is, because they are dynamic documents, that they get adapted and reviewed, and also they are created by your informed activists, experts. can start shaping a little bit more of what that good looks like. I think, it'd be, from our perspective, sort of the scope of standards and accreditation is really fundamental in what can be achieved within creating governance frameworks around AI. So we work very closely with the UK accreditation service, UCAS, who accredit companies that provide certification to check to make sure that there is compliance matching to what the standard requirements are. And that in itself becomes a really powerful mechanism, a powerful framework that demonstrates that companies are doing the right thing, that platforms are providing an element of that trustworthiness. So what lessons can you, on how standards are being used, can we adopt, can we borrow, can we learn from other sectors and what's already out there?
Yeah, I would say that what we've seen an increase in over the last few years is publicly available specifications. The Office of Product Safety and Standards has supported and sponsored a few of those, and that's basically fast-track standardisation, that where you see an urgent need or a risk, that's addressed kind of immediately. Done that with the button and coin batteries, where children were swallowing button and coin batteries, and it was causing serious injuries or death. So there was a publicly available specification on that to kind of address that immediate risk, and it was done very quickly. It's stakeholder engagement, and is reviewed after 2 years and taken forward to a standard if that's appropriate. So I think looking at these fast track standards
Yes.
is a really good way to deal with emerging and urgent issues to be addressed.
Yeah, that's really interesting. That's really helpful. JD, you're seeing lots of lessons that can be learned, that can be adopted.
Yeah, I mean, I guess that the first lesson you learn is to understand what a standard is.
Yeah.
Because actually in the early stages of adopting AI, so what we tend to rely on is best practices to begin with. So we heard about the Scotland's AI playbook, and from a healthcare perspective, we'll contribute to that. And that's kind of a form of informal standardisation. So that's peers coming together and distilling down what's good, and distilling down what's important. But it's not enforceable, it's just something you should follow. I actually find that once there's any piece of good guidance out there when you're in a new market like AI and healthcare, people grab onto it as quickly as they possibly can. So it's sometimes the opposite of what you think will happen. Actually, anything that becomes available, we try to grab onto it. But the standard is just one of a number of a basket of measures
Yes.
that you put in place for governance, really. We do things called DPIAs, data privacy impact assessments in healthcare, and when we look at that, we look at standards, legislation, regulation, behavioural controls, contract controls, technical controls. So it's important to remember that standards fit into a wider basket of measures, but it's also, I think, really important, just taking engineering as an example. So the beautiful thing about engineering standards is that you've got overarching standards that look at quality management and risk management, the big process-based standards, but actually you'll get a standard on how to manufacture a screw that goes into a wing, that goes onto an aircraft. And we're starting to see, I think, in healthcare now, that radiologists want to have standards about AI and radiology. So do pathologists.
It's amazing.
Cardiologists. So that lower level of standards, that more precision, smaller, I think is going to be more and more important, because once you get familiar, once it's not new anymore, you get to start to hone in on the more specific.
Yeah, absolutely.
Can I just,
mentioned
just
engineering.
just a kind of thought there that kind of occurs to me is, so when we're doing systems engineering on a large product like a car or an aircraft, A lot of that's about defining how to chop it up into smaller pieces, and then define how those smaller pieces are going to interface with each other and talk to each other, and then build them back up and validate that they're working at the unit scale and then at the system scale all the way back up to the top. And I wonder how our standards in this kind of area should deal with that, and what are the sensible interfaces to put between things so that we can be certain that within that interface we know it's going to work, and we know that it's going to have predictable behaviour when we compose things back up with them.
Yes.
And that's actually really interesting, because in engineering you tend to plan everything out to the nth degree. In healthcare, bizarrely, when we're talking about software in healthcare, we quite often don't plan everything out to the nth degree. So it would be really helpful if we had, for example, a reference architecture for AI in healthcare, something that says, well, how do the bits fit together? How do you compartmentalise that? Those sorts of things I think need to maybe not pre-exist the standards, but they need to come alongside the standards. What is the architecture for AI in healthcare that we're trying to achieve? And then which parts of that do we need to standardise, regulate, legislate?
Yes, that's really interesting. And Andy, you touched on engineers and how engineers think about products. I mean, there's lessons there to be learned about how we think about how they implement AI and the competencies that will be required for that as well.
Yeah, I suppose one of my thoughts is how this embeds in. So as a professional engineer, we agree to abide by a code of ethics that goes along with our professional institutions. And I'm pretty sure that the IMechE that I'm involved with doesn't have anything that mentions AI or machine learning in there.
Yes.
And yet, increasingly, we're starting to use these technologies without really thinking about it. So I'm kind of interested in how they will have to evolve so that we can do this in a more structured way. It also strikes me, just one other thing is, from an engineering perspective, we often use factors of safety. So, if you've got uncertainty, you just increase your factor of safety. And if it's 2 or 3, it'll be fine. Give ourselves space to be wrong, if you like. I don't think that necessarily applies here, because when it goes wrong, it can be maybe badly wrong very quickly. So how do we deal with that, I suppose, is one question.
Really interesting discussions. Thank you so much for the questions. We have page upon page of questions. So if we don't get a chance to answer them all, which unfortunately we may not be able to, that is quite overwhelming. We will try and pick up, and you now know who we are and where we are, so please do reach out to us. So I'm going to pick sort of the ones that have the highest likes, and please do carry on liking so that they can jump up the lead. But a really interesting one is, how can standards keep pace with rapid developments in AI, and how do we manage lack of trust or trustworthiness before the relevant standards are released? So how can we manage this before standards are released?
Before a standard is released, all the interested parties come together. There's public consultation, so there's the opportunity to feed back into that standard if there's something that's perceived as missing, or the committee meet for a long time and have lots of discussion and lots of sharing of documentation, and your standards is good as who is involved in input into it. So having the right experts and the right expertise within the standards committee really make a strong standard, and then also through the public consultation stage. And as you say, there's also scope for, even once a standard is published, for then that being reviewed and taken into account new technologies and new issues that are emerging.
Yes, absolutely. That's a really good point. It's really about the stakeholders in the market that they come together, and that discussion in itself. And once a standard committee is developed, it remains, even though they're not developing something, they will still meet up to see how the standard is being used and whether it needs to be changed. Another interesting question: how much people who are working in your field really care about trustworthiness of AI? And I put the emphasis on really care about.
I mean, clinicians really care about trustworthiness. They really do. I mean, at the end of the day, so where AI is being used right now is mostly clinical decision support. So I yet to see in Scotland any autonomous decision-making AI being used in a clinical setting. And so the liability and the risk still sits with the clinician, with the health board. So they really care if the AI is wrong, if it's unsafe. So having a safety-related aspect always helps when it comes to trustworthiness. But if you look at the different stakeholders, I'm not sure how much the public really at this moment in time engages with trustworthiness in a healthcare setting. They might interpret, safety. Is it safe? But actually, I think the trustworthiness for the patient lies with the clinician. So they trust the clinician to use this piece of AI in a way which is safe and effective and efficient. So, I think people care because people's lives are in the balance a lot of the time. But actually, it's the clinicians, not really the patients.
Yes. I think that's a bit different in products, isn't it?
Yeah.
Because people suddenly have this view of what's trustworthy.
Yeah, but I think people automatically think that there's safeguards in place. So they think
Yes.
if I can buy something, if I can get something, there's somebody else taking care of that.
Yes.
So and that's known that can sort into in terms of safety and trust. But that's not the thing that actually features the highest in terms of their likelihood to buy it. It's the cost.
That's really interesting.
Yeah.
I wonder if you would ever use the phrase trustworthy in, if a patient come into hospital and they're going to get an MRI scan or a CT scan. I wonder how many people think to themselves, I wonder if that MRI scanner is trustworthy.
Yeah.
And so, when you look at this, AI is it's a product, it's a piece of software, but in a lot of, not all respects, but in a lot of respects, it's no different from using a piece of medical technology that already exists. And yet, I'm not sure people are asking the same questions in relation to those products as they are in respect of AI.
That's a really good point. It is, at the end of the day, AI is a tool. So I always say it's a bit like an axe. It can be used for all sorts of different things. So it's how it's being wielded, isn't it?
Yeah.
Is there also an aspect of this, is to almost look at it from the other side, is how do you design teams and organisations where some of the trade-offs that are inherent in being trustworthy are valued? And, because if your job is to get a piece of code out for the release next Friday, your stress is about getting that done and through the system and out for Friday. Your CEO might be saying, we're really bothered about ethics and trustworthiness.
Yes.
But the two things might never join up.
Yeah.
Yes.
And so how do you design a system where it's part of the whole balance and it's not? I would guess engineers are most bothered about making something that works.
That works. It's actually quite interesting.
And trustworthiness is part of it works.
It's quite interesting, actually. We have a question of how much do people actually care? Because, Microsoft has laid off entire AI ethics teams while talking about Chat GPT, and it's barely made headlines. So how are we educating people on why trust matters? And if we don't standardize, what could be the impact of this? Is there here a sort of are we saying the right things when we talk about trustworthiness? And what, are we teaching and explaining it properly to people so that they can actually equate the damage that it can do with what is being developed right now?
Yeah, and I think there's huge concern, especially when it comes to kind of chat profiles and things like that, where if it can promote self-harming and dangerous content, and that's so harmful to our children, and it really has to be. So they are looking at that, and government are looking at that in terms of the online safety bill. So there'll be huge fines for companies that promote that sort of content. And I think that once it becomes, once those fines come in, then that can refocus. So that's where we say that where regulation is needed. It's because we need to have sanctions against that.
That's right. We were speaking today at the keynote. It's when companies actually start seeing their bottom line being damaged.
Yeah.
And
something has to go wrong, I think, before people
Yeah.
really. So there's the concept of trustworthiness. I think most people understand, but it's ethereal. It's something that thing that'll never happen to me. It's the same as risk. Any risk that'll never happen to me until when one day it does. And at the moment, the dialogue from manufacturers of AI is largely, look at this shiny thing that I have built for you. Why wouldn't you want to use this? It's amazing.
It's better than that shiny
Yeah,
thing.
it's better than that shiny thing, but no one says this is a shiny thing and it works properly and it's trustworthy and it's ethically and it's unbiased. There's not a lot of people saying that because actually you need to tell people how it's gone wrong a lot of the time before they stop and go, oh yeah, okay, well that might actually happen to me. So we had an example. We were building an AI product that was in breast cancer detection. We tried it in one hospital, cancer recall rate of about 14%, which is a little bit high, but almost right. Then somebody upgraded the software in the mammogram, the scanner, and something like 97% of women would have been recalled as having breast cancer.
Wow.
Now, that happened in a research environment, but if that happened in a real clinical environment, you could be damn sure that almost instantly people would be concerned about the trustworthiness of the AI in healthcare because it would have a real impact on a large population of women.
Gosh, yes, absolutely. A question here, very, very specific to Andy. You mentioned Rolls-Royce as a checklist when building AI systems. How is this checklist created? Was it an internal process? Or took some organisation or other government body?
I think it was driven by a need to have something like that internally.
Yeah.
So it's online, Alethea framework, and you can download it and use it. I think it's pretty good. But I think it started off from them applying it within their own operations, and then I think they did go out and consult more broadly, and did get some engagement from the rest of industry in setting it up. Yeah. And I think it's something that will evolve.
Yes.
I don't think it's by any stretch of the imagination the end point.
Yeah.
But I think it needs probably people like me and people in this room to start using these things.
Yes.
And actually really embed them in the way we do our jobs.
Yes, absolutely. Is there a point of creating a standard if no one is adopting it and no one picking it up? There isn't really. So the more people that can adopt it, the better it can be, and the better it can be used. Actually, that I'm looking at a question here about what measures are taken to identify and mitigate bias that may lead to unfairness. That reminds me a little bit, Michelle, about sort of consumer vulnerability. And I know that consumer vulnerability is a big issue where organizations can't identify when there is a vulnerable consumer, and they've really gotten into trouble by putting pressure on vulnerable consumers. And there is some work there that CPIN have led on.
Yeah. CPIN looked at consumer vulnerability because there was the definition didn't include everybody can be vulnerable due to circumstances. During the pandemic, there was a lot, the vulnerabilities increased dramatically, so there's a standard specifically looking at vulnerability and how consumers should be treated to address the kind of full range of vulnerabilities and open up that and expand that definition.
Yeah, I think that's a really good example of sort of utility providers utilising that standard and then providing that sort of certification for companies that have actually really considered, the utility companies that have considered the need for having those processes in place within their company to identify vulnerable people and be able to sort of reach out to them. And we see, that could be a really good basis to start thinking going forward about bias. I know bias and unfairness is the next, that also, how do we tackle bias when the data already has bias in it? How can we create a bit more of that fair environment?
Yeah, it's interesting. So in healthcare, there's a couple of things just starting to be introduced. So the quality impact assessment that didn't have to be done when I started the iCare program, but would have to be done if we started it again, forces you as a project to look at how you're dealing with inequality within the design of the system, the delivery of your project. And then the Ada Lovelace Institute have designed an algorithmic impact assessment, which is more a conversational tool at the moment than anything else. So it tries to get you to ask the right questions about where might there be bias, inequality, unfairness. It encourages you to use some of the NHSX documents which list some of the areas where you might find inequality and unfairness. But ultimately, we have to start measuring it. So I don't really see anywhere in healthcare AI where people are routinely measuring bias.
Yes.
So you have to have metrics from the data. You have to have metrics from the impact of the algorithm. And this becomes especially important once we start to adopt it into healthcare, that post-implementation monitoring. The first stage is to measure before we can do anything about it. And I don't think we've even reached that stage yet. So I think, that it's incumbent upon me and some of my colleagues in the audience, Sandy up at the back there from Canon, Leslie, people who are working in
Shout
healthcare.
out.
Exactly. It's our responsibility to start to measure within our projects, because at grassroots, I think, is where these things ultimately start. We could wait for a top-down standards committee and government policy, or we could just say, we see this happening on the ground. It's the activism approach to things, and I think it's got to start with measurement.
Yeah, I think one of the biggest questions here is how do you measure trustworthiness in practice? And are there any differences between this and accuracy? I think you just sort of highlighted that in your discussion, but also the role of the National Physical Laboratory for measurements and providing accuracy standards, fundamental. And the standards around AI terminology and concepts are huge international ISO standards. And if you're interested, do have a look at them. The foundation, as you say, is about defining what we're talking about to begin with. It seems that, we're still at that phase. We know that the technology is very advanced, but we're almost still talking about what do we mean when we say AI.
Yeah.
Brilliant. Well, I'm very conscious that we're out of time. Thank you so much for all your wonderful questions, and we're really sorry that we didn't get a chance to answer them. Thank you. Thanks, everyone. There's more resource on BSI website, but also do look at the AI Standards Hub and join the community. Thank you so much.
Thank you also very much. What an amazing discussion. I have been hearing about AI standards for years, and I think I learned more in the last 55 minutes than over the previous 5 years. So thank you very much for this great discussion. Just to give you a bit of information on what comes next.